You're listening to On Shifting Ground from Commonwealth Club, World Affairs, and KQED. I'm Ray Suarez. Let me take you back to August 2020. The initial shock of sheltering in place is worn off, and maybe you've been spending a little more time in the backyard, slowly sipping your favorite six-pack. When you spend family time, it's on Zoom, where you catch up with your sister and her husband. They're wearing their best Hawaiian shirts, drinking Mai Tais, and planning where their first vacation will be once the stay-at-home orders lift. The next day, to fill the time, you have a Zoom happy hour with old high school friends, and maybe follow that up with a little wine over dinner. Rinse and repeat. For the most part, the world has gone back to normal because we're getting on planes, going to the grocery store, meeting up with friends for beers at the bar around the corner, but many Americans haven't changed their pandemic drinking habits. And this increased consumption trend is especially high for older Americans. In 2020, alcohol accounted for more than 11,000 deaths among those 65 and up. That's an 18% increase from the previous year, and many of those cases went untreated. Why? To answer that question, here's Keith Humphreys. Keith Humphreys is the Esther Ting Memorial Professor of Psychiatry and Behavioral Sciences at Stanford University. Welcome to On Shifting Ground.
Very happy to be here, Ray.
Well, Professor, the numbers are astonishing. A rapid rise in the number of alcohol poisoning deaths among older Americans. What's driving this long-term trend?
Well, there's two things going on. There's some of this trend has to do with our country in general. Americans are drinking more. Our alcohol consumption has been rising for about 25 years, the whole population. And then there's some things specific to the elderly. One is it's a different population of people who are now old. Our ideas of who's old is probably a fly trapped in amber. I think about my grandma when I was a kid, but that's not who's old now. It's the boomers. Though they felt eternally young, they are now old, and that generation used more alcohol, used more drugs too, and those things have combined effects on their health. And so both of those things are going on.
Are we talking about cumulative effects or just a different onboard attitude now that they're 64, 71, so on?
Yeah, so there's certainly people who are dying of very long-term consumption. So that could be liver cirrhosis or cancers of the GI tract. But older people are the group that has if they drink, often drink almost every single day. And so that puts them at high risk for things like falls or car accidents. And that can just obviously be very sudden.
I sometimes roll my eyes at observations about this generation or that generation. Boomers do this, Gen Xers and millennials do that. I think a lot of that stuff is way overdone. But now that the big post-war born generation has aged into its 60s and 70s, what do we know about their attitudes toward the use of alcohol and recreational drugs?
Something we have very good evidence on, because alcohol is a legal product, is who buys it. And we have fairly good surveys on who drinks it. And a big change in America is about women. If you go back to the people who were born 100 years ago, for every 3 men who drank, there would be 1 woman who drank and 2 women who abstained. And that was partly about gender roles in that generation, and that was partly about religion. Women were more religion, and religious people are more likely to abstain. As you go forward in time, women start drinking more and more, closer and closer to men's levels of drinking. And we do see that disproportionate increase in deaths, both among older people as well as the population in general, in women. So that's part of the story. The other thing is that the experience of being older has changed because medicine has changed. We have far more medications than we've ever had before, and obviously many of them are miraculous. The average person over the age of 65 is on 4 medications, and those can be medications to help people go to sleep, help them wake up, medications for pain. All those things can be good, of course, but they also interact with alcohol.
It's long been understood by policymakers that after you pass 60, you begin a long journey into your most expensive years as a human being. When it comes to maintaining your health, the things that happen are expensive and extensive. Doesn't this make an already bad situation, this demographic challenge, this gray tidal wave, even a bigger problem?
Absolutely. And it's on all of us because the elderly are the one population that we all agree to pay for their health insurance through the Medicare program. And one of the things that is unfortunate is Medicare actually doesn't cover addiction treatment particularly well, and it really ought to. I testified to the Senate Aging Committee in December and made this very case, is that it actually would be cheaper for us to make sure the elderly could get alcohol treatment than it is to pay for the accident, the fall, the cancer, the cirrhosis. But it's an uphill struggle persuading people of that.
So if you go to your provider and you say, look, I think I'm drinking too much.
Yeah, you're not guaranteed that you would have parity in your benefits. So, the norm for most insurance these days is that there's a law known as the parity law, which says that any benefits for substance use disorder and mental health have to be as good as the benefits you have for everything else. And it applies to Medicaid. It applies to any insurance you get from an employer. It applies to if you buy a plan on the state health exchanges. But funnily enough, Medicare is exempted from that law. And it's very unfortunate. It's a surprising hole in our net of care for older Americans.
That would seem almost counterintuitive, Professor, because if someone presents saying for themselves, I think I have a problem, couldn't you end up saving the system a great deal of money by treating their alcohol abuse right now rather than waiting till they've wrecked their liver?
It's absolutely the case that it's cheaper to deal with things preventively than try to clean up afterwards. But historically, it's something we've often had trouble with in the healthcare system is thinking about prevention. We react when someone's in a lot of trouble, but we often miss opportunities to direct them down a different path so that never happens in the first place. It's also worthwhile noting that many older people may not ever bring it up with their doctor, but that's a role all of us have who love people who are older and can check in with them respectfully, caringly, but asking your mother, your father, your granddad, your uncle, your aunt, how are you doing? And that's where a lot of people may get that first indication of feedback rather than from a physician.
Well, look, I'm in my 60s. I don't wake up every morning thinking about the things that I can't do anymore that I used to be able to do. Should anybody my age be thinking about how alcohol might affect me differently? What's different about the way your body metabolizes the better part of a bottle of wine or a couple of beers from, let's say, 40 to a quarter century later at 65?
We are often smaller, so people shrink a bit physically as they get older. There's less space to distribute the ethanol through your body. And we become less efficient metabolizers in general with lots of things, medications as well. So the same amount of alcohol can hit us harder than it did, when we were 40, 30, 20. And these things creep up on us. It may be something that you don't notice that much from 50 to 51, 52, 53, but then, all of a sudden you find you're hungover from a very small amount of drinking the night before, or that you fall asleep at the wheel, which something you never would have done before, but it's because you've had a drink at the restaurant and it knocks you out in a way it never would have when you were young.
When I have had to fill out paperwork involving health habits recent hospitalizations and so on, the questions have become more detailed about alcohol use rather than just a sort of general yes-no binary function. They're trying to find out what you drink, how often, in what quantities. Is that new? And is that something that should become more universal?
Yes, that has been a good thing over the last 40 years, is that brief consultations about drinking are much more common in primary care or when you're admitted to a hospital because doctors are learning drinking has a lot of effects on the medications you take, but also things like, how does anesthesia affect you if you're having a surgery? And it can help them give advice on things like if you're going to be pregnant, for example, or if you're going to be going on a medication that is sedating, they should be asking about alcohol. So there's been some improvement there. It's usually in paper rather than doctors asking. And of course, some people may not quite tell the truth. We aren't always completely honest with our doctors, but at least if someone does, it gives a chance to open that conversation and for the person to get some non-judgmental information about the potential effects of drinking on their health.
Well, you study behavioral matters. Are people likely to tell the truth when they're asked something like this that could be potentially embarrassing? I mean, if you're drinking 5 or 6 days a week, might you be reluctant to say so, but more likely to put it down on a piece of paperwork during an admittal or something?
It's a very interesting phenomena in that we have good data on how much alcohol is sold each year in the United States. Excellent data. When we add up from surveys how much Americans say they drink, it only comes out to about 50 or 60% of that alcohol. So either most people buy a bottle of wine, pour half of it down the drain, and then start drinking, or we fib a lot, or we forget a lot. So it's definitely a phenomenon. And, what can we do about that? Well, certainly not being judgmental is probably the most important thing to promote honesty. If you ask, "You're not drinking, are you?" is a hard question to say, "Yes, I am in fact drinking." Whereas if you're working with a patient, just sort of generally, so tell me about your drinking, without any implication that there's a correct answer you're supposed to give me, that can open up the dialogue, make the person not feel, that they can't talk about what's going on.
I purposely waited for a while to sort of lay the foundation during this conversation before I started talking about the pandemic. It forced people out of each other's company, especially older people, who were already prone to loneliness, already having serious problems in making and keeping long-term friends. Do we know yet what effect the pandemic had on drinking? Are there good numbers yet for 2020, especially before there was a vaccine and older people were really scared of being in each other's company, but also 2021 and 22?
So it's interesting what happened to drinking during the pandemic. People went in different directions. I actually noticed myself that I had like a few bottles of wine that sat there for 6 months. And it was because the only time I ever drink is when people come over or I go out somewhere to a restaurant. I stopped doing that. People like me, sort of socially oriented drinkers, drank less. However, people who tend to drink alone and people who drink for relief, for example, relief from feeling sad or lonely or depressed or scared, drank a lot more. So the average didn't change that much. These sort of effects canceled each other out almost at the population level. But we see in older adults a surging of binge drinking during the pandemic. And of course, these deaths went up pretty sharply, in the pandemic. And those things have to be related to the kind of person for whom that emotional environment and that isolation is a fuel for drinking really suffered in these last few years.
When I was thinking back in preparation for this conversation, thinking back to the earliest days of the pandemic, when my wife and I were stuck in the house a lot, we joined a couple of Zoom cocktail parties, something that didn't exist before, obviously, but something that we never would have done before. I pulled out the blender and tried some of the recipes that suddenly seemed to be everywhere online and in magazines and so on. When a neighbor would actually venture over and we sat together in the backyard 6 feet apart, what did we do? We had beers.
Yeah, and you could do that because you were in your house. So think how odd it would be normally for the average person who goes to an office to start drinking at, say, 3 p.m. People would say, "Hey, you're supposed to be getting some work done here. Plus, there's no alcohol in your office." But you're sitting on your back porch and no one's really going to know. And, the alcohol is right there. Why not? We lost structure, and those settings where you would never think of drinking dissipated. And some people, in fact, did drink more. And, some part of it, there was a good side to it of, relief when we're all feeling lonely. But for every situation like that, there's someone who's sitting there with nobody and just their bottle and drinking and doing damage to their health. And there was a lot of that, unfortunately, during the pandemic.
Suicide also went up. Can we correlate those two, or should we be careful about that?
No, that's true, has been true over a century of data we have on suicide, is drinking problems are a risk factor for suicide. And in fact, many people who commit suicide are intoxicated on something when they do it. Big chunks of suicides are impulsive acts. And when people drink, their inhibition of their impulses, most people's drops. And so, say someone who's depressed, has a firearm, might do something to harm themselves that they would not do if they were sober.
I wonder what the policymaker, public health pushback would consist of. I think anybody who would venture out into public now and say, come on, everybody, let's think about this a little bit more, would be dismissed as a scold, would be dismissed as a Puritan, would be dismissed as a busybody. What should the messaging consist of? Here we are with these huge numbers of people dying of alcohol poisoning. We got to do something, but it's hard to know what.
Yeah, I'm struck by the contrast of if I said fentanyl is a problem, no one would disagree with me. Say, 80,000 deaths from fentanyl. My God, it's horrific, and it is horrific. That's less than half of the number of people who are dying from alcohol in our country each year. But when you bring up alcohol, there is the reaction you mention of, it's beer, it's good. And part of that is cultural. We've accommodated to this drug, and it is, of course, also connected to a lot of very positive things. You have a glass of champagne at your child's wedding. It's in religious ceremonies. There is meaning and joy and connection around alcohol. And it's also partly the influence of the industry, I think, has been very successful at persuading us that alcohol is not a drug. Not like other drugs. We don't need to worry about it as we would worry about other drugs. And we shouldn't constrain its advertising, its promotion, and we should tax it very lightly. Those are not good policies. I don't, favor going back to prohibition, but I don't see why we need to, for example, cut effectively in real terms the price of alcohol every single year. Why are we doing that? That doesn't make a lot of sense. Do we need to have as much advertising and promotion as we do? I would say that we do not. And that, by the way, one of the stories here is women's drinking going up a lot. The whole mommy juice, wine mom culture, all that was created by the industry. It was a conscious strategy. About 25 years ago, they realized women were getting more disposable income, but they weren't drinking. So they did a lot of female-targeted advertising, kind of soft focus news stories about, women and wine and that kind of thing. And it really worked. And it's interesting now, I talk to students who are questioning this. Young people actually are rethinking drinking a lot. And sometimes the women will say, well, I feel like, I should be drinking. That's what a liberated woman does. And I always say, that's what the alcohol industry told you. But a true liberated woman would make her own decision. You don't have to do this just because it's been glamorized and sort of packaged as this is what it is to be a modern woman, is to have a glass of wine in your hand. So we don't need to do that. We don't need to allow advertising and promotion at the level that we do. We don't need to allow it to be as cheap as we do. We don't need to have as many alcohol outlets as we do. Those are things that around the world, when governments change those things, changes in alcohol problems, improvement in their alcohol problems, is a pretty consistent outcome.
Are there good comparative numbers? Because I've been in countries where it's expensive to get hammered and part of the culture.
Yeah. Culture is a force, right? And no matter what policy does, culture affects many behaviors, and it certainly affects substance use behavior. And, on the other hand, we have parts of things that are very pro-substance use. What do you do on Friday after work when you go out? Well, usually they go to a bar. You don't have to, but that's usually what the normative sort of middle-class place is. That's where people go. And those kinds of things are things we all have to decide if those make sense to us or not. And, we have the power to change those things in our own lives, in our own workplace, and so on. It's very hard for government to regulate culture, but government can clearly make a difference. Government can nudge us, just as the industry tries to nudge us. Government can nudge us too, with pricing, with regulations, with limits on advertising and promotion.
That would mean elected officials risking not being popular. Is that an easy conversation to have?
A very potent point about our politics. There is not a congressional district that does not have a beer distributor in it. And all of them, of course, have retail outlets. And they are some of the biggest lobbies in Washington are the Spirits Council, the Beer Institute, the wine industry. So, yeah, it's a challenge. But I would say the tobacco industry was every bit as intimidating for a very long time. And then people decided, first off, they didn't want all this health harm. Second, they didn't want the public to be on the hook for all this health harm. That's part of the thing to remember is it's not a free subsidy to keep taxes low because then we all pay for it in crime and in health. And sometimes those arguments can get people the courage they need to say, look, in the long term, I want to be a steward of the public purse. I want to protect people in my district. Therefore, I am going to take some actions that, even though they're going to make the alcohol industry mad at me.
But it wasn't a short or linear walk to that new attitude toward smoking. There was a much more liberal regime in place, it took a while to get everybody on board at the same time. And I would imagine that alcohol would in many ways be similar, because what's the incentive? The incentive is to be the laggard. If you're in a place where the states are not huge the way they are in the West, but where it's a very easy matter to just quickly drive across jurisdictional lines to get a much cheaper bottle of scotch, a much cheaper bottle of wine, the reward goes to the jurisdiction that trails behind, not to the one that gets into the vanguard.
The retail reward does, certainly, when you, and a lot of Americans live close to a state border, for example. But the health and crime rewards go to the people who, restrict the product. Yes, you may not have as many drive-by sales, but you'll have fewer car accidents, you'll have fewer murders, you'll have lower cancer rates. And that's what you get by being on the leading edge of restricting drinking.
Over time.
Over time, yeah. These are very long, we're talking about very long waves. This is 25 years of increasing drinking. And many of the health conditions we're talking about take 25 years to take someone's life. So it's these are long waves, but long journey starts with a single step. So this seems as good a time as any. And these numbers, I hope, will spur people to take that step.
Do you have the ear of legislators? Do you have a channel, a venue, a place to have that conversation where you can talk to people in your own state, in Sacramento, or people in Washington, and say, we really ought to be talking about this, in part because we can't afford Medicaid and Medicare on the trajectory they're already on, minus the drinking?
Well, funnily enough, I'm in Sacramento to testify in our legislature about drug problems, and I do talk to state and federal legislators all the time since during the opioid epidemic. But interestingly, those conversations tend to focus on the illegal drugs and not so much on the legal drugs. So I can bring it up and say, what if we taxed alcohol more highly? But it is a rare politician who opens that conversation on their own. They're far more focused on how do we stop so many people dying from fentanyl and from methamphetamine, which obviously is a terribly important thing, and I'm glad to work with them on. But the alcohol conversation is a much rarer one.
Well, if I try to think about a product that is as deeply intertwined with the history of American agriculture, American commerce, American culture more broadly, it's tough to beat alcohol. I mean, the story of the early republic, a lot of it has to do with getting alcohol from point A to point B, how you bond it, how you tax it, whether people can make their own. Stock car racing is an outgrowth of running away from revenuers who are trying to bust illicit stills. I mean, it's deeply ingrained in the national DNA, isn't it?
Absolutely, as was tobacco, by the way, both historically, some of the early commerce, but you didn't see a picture of a soldier at war without a cigarette in hand. And in fact, both wars, American cigarette smoking, especially among men, just soared. It was the manly thing. Everybody had a cigarette in their hand. And we changed a lot. And tobacco still exists. Alcohol will still exist and should still exist. It doesn't need to be wiped out of society. It has many good things that are valued. This is a question of, helping the people who are having problems with this, not taking it away from the Seder meal or the glass of wine at the wedding and all those kinds of things. That's always going to be part of life, and that's fine. That's not going to harm us. But how important is it to our society to have somebody sitting alone, drinking without friends during a pandemic? We don't want to keep that, So I think we can have our cake and eat it too. We don't have to have that to have alcohol.
Given this rising fraction of the population that is over 65 and the disproportionate health effects that we've been talking about, is that a good place to start the conversation?
I think that it is. And I would add, by the way, that in the past 25 years, we've also seen about a 400% increase in drug overdoses among the elderly. So that might be a population that we're all comfortable talking about, and also because we are all invested in that, not just because we love our parents or grandparents, but because in policy terms, Medicare is paid for by all of us. And we can decide, for example, is alcohol treatment well covered by it, or not. We can decide, is paying for all the damage of alcohol make sense to us rather than paying for preventive measures that would stop these problems? So maybe that's a conversation we can have. So in that front, I'm optimistic we might be able to do something to at least improve what Medicare covers.
Keith Humphreys is a professor of psychiatry and behavioral science at Stanford University. Thanks for joining us on Shifting Ground.
Really nice to talk to you again, Ray.
You've been listening to On Shifting Ground, produced in partnership with KQED, with support from listeners like you. Today's episode was produced by Matteo Schimpf, Elise Manukian, and Andrew Stelzer. It was mixed and mastered by Matteo Schimpf. Additional engineering support was provided by Rob Spate. Jim Bennett is our technical supervisor. Jared Spord is our executive producer. Philip Yun is co-CEO of Commonwealth Club and World Affairs. Our music is from Blue Dot Sessions. I'm Ray Suarez. Thanks for listening.